Now I'm going to talk about people with bipolar disorder, and more specifically someone who's in a manic phase, because they're going to be the people you encounter on the streets. Bipolar disorder is mainly a mood disorder. People tend to have mood swings. They go through phases where they're manic, where they have high energy, or long phases where they're depressed. A person with bipolar is probably most noticeable in their manic phase. When someone's manic, they have high energy. The energy is sometimes more of agitation. So a person might be physically very restless. They have what we call pressured speech. They sometimes cannot stop talking. You see someone on the street moving fast, talking all the time, again, looking very different, they well could be bipolar. The energy leads to racing thoughts. So their mind literally is going very fast. And if they talk to you, you may find that they just fly from subject to subject to subject. Some of them, their mind is going so fast and their speech is so fast that they are incoherent. They'll be talking what we call word salad. It makes no sense at all, but it's very fast. So again, they have high energy. They don't need much sleep when they're manic. So you might see, as an officer, you might see one of these individuals on the streets at night. And then they have the mood component. Often they are grandiose. At times, a person who's manic will feel invincible. For you officers, you might find a situation where a person feels that they cannot be harmed. If you recognize that they're manic, that they're an individual with a psychiatric disorder, you immediately want to take the perspective, we need to get you help. We need to get you help. Tell me where you live. Can I get hold of your family? Should we take you to the hospital? But you want them to get help. The bipolar, when manic, are often also psychotic. So they can have delusions. They can have hallucinations. Again, delusions can be paranoid. Somebody who's manic, actually, usually the delusions are very grandiose. Common delusion is that one is Jesus Christ. Some of you officers have probably met people that introduce themselves as Jesus. That can be a clue that, of course, this is a person with a psychiatric disorder. Though there are, of course, a number of people in Las Cruces named Jesus, but the patients tend to use Jesus as a name. Again, they have grandiose delusions. They're a millionaire. And, of course, like the schizophrenic, they may have some bizarre behavior, maybe may have not slept for days, so again, be disheveled, maybe have some troubles with hygiene. The most common mood is that of feeling euphoric. You know, people will say they just feel great, and again, that puts them at risk to not comply with medication because they want to get that natural high. Actually, there's many different moods of the bipolar. Again, the bipolar can be depressed. Usually, they're depressed about 70-80% of the time of when they have active mood episodes. Also, they can be very irritable. Many people are very irritable, and they will have a tendency then to argue with people, even yell at people. So a manic who's very irritable might yell at a police officer. And again, you'd want to de-escalate. You'd want to take time, talk them down slowly, say, sir, we can work this out. Just listen to me carefully. I'm going to repeat myself. But again, you'd have a person agitated perhaps. It might even look like they're on drugs. In fact, some of these individuals, some of these people with mental illness, they're going to look like they're on drugs, but it comes from the agitation. These are people that are at risk for suicide, so there'd be an issue of suicide by a police officer. Manic, an agitated, angry manic might try to provoke a police officer. That's something you have to watch for. The treatment for bipolar disorder is mood stabilizers. The classic mood stabilizer has been lithium carbonate. Other mood stabilizers are anticonvulsants. People will take Depakote, people take Tegretol, people take Lamictal. The newer atypical antipsychotics, we call them the atypical antipsychotics, the second generation antipsychotics, are also mood stabilizers. So you'll have bipolar patients on a mood stabilizer such as lithium and on an antipsychotic, again the group of Zyprexa, Seroquel, Risperdal, Geodon, and Abilify. And bipolar patients sometimes will be on 4 or 5 medications. They can be very hard to stabilize. Again, their moods, they have manic episodes, they have long depressive episodes, they sometimes even have mixed episodes with both symptoms, and the mood stabilizers help to smoothen out the cycling over time. And again, you're most likely to see the bipolar patient when they're manic. Many psychiatric patients do not comply with their medication. Similar reasons as with schizophrenia. Can be due to side effects, can be due to poor judgment. When a person is manic, one of their literal symptoms is to be very impulsive. People will spend lots of money when they're manic. They'll be hypersexual. They'll have affairs, and an individual who in no other time would have a sexual affair. The judgment and the impulsiveness can affect them not taking their medication. Also, a lot of manic patients enjoy the mania. It feels great. It can feel great. I treated a nuclear physicist one time, and a brilliant man, published in Scientific American and other worldwide journals, went to meetings worldwide, presented papers, debated with other individuals. He was convinced that his creativity came while he was manic. So he would tend not to take his lithium. Though his wife wasn't convinced of that, and she was ready to divorce him if he didn't take his lithium. So after a couple of hospitalizations, with his wife literally saying he had to take his medicine to maintain his marriage, he took his lithium, took it for a couple of years. He published 3 times the articles that he usually published. He was much more productive. And he came to realize that he just enjoyed the feeling of a manic state, but that he had to give that up, and he was able to do that. There's a disorder called schizoaffective disorder. It's kind of in between schizophrenia and bipolar disorder, and it has both elements of psychosis and a mood disorder. That's why it's schizoaffective. Affective addresses the mood disorder. So someone with a schizoaffective disorder, they're usually somewhat like the schizophrenics. They're dealing with psychotic symptoms. It may again be delusions or hallucinations, but they also have a mood component, which is either to be depressed or to have mood swings. So if someone says, I have schizo something, it's very likely a schizoaffective disorder. They could be depressed or they could be very moody. With the individual with bipolar, again, you want to take the approach of slowly de-escalating them. Again, often their mind is racing. They'll have a lot of trouble, may have a lot of trouble understanding you. They may, again, continue to talk continuously even while you're talking to them. I find it helpful to repeat myself a lot with a person with bipolar. And I will repeat myself 5, 10 times, whatever. You need to slow down, you need to slow down. I'm a police officer, it's very important you listen to me. We'll handle this situation, we'll take the time, but we'll take the time and let's slow down, de-escalate.